Good afternoon. From Joy Wellness Partners, I want to introduce myself, Carol Bender, as lead founder of this regenerative functional health clinic, as well as nurse practitioner. And I love running this clinic now. It's just been so inspirational. All of you who are coming to our clinic have made us who we are, and our J2P family is strong and happy to be growing and happy to be serving you. So today's talk is going to give you a little bit more insight as a, what is in it for me? Like, what can I benefit? How can I recover my pain or my injuries without having invasive procedures or looking at a higher level approach than rehab or chiropractic or physical therapy? Like, what if it's not quite moving the needle with what I've been doing for recovery? What are some other things I can do to harness my body's own capabilities to heal itself? So you can read the disclaimer that we are not using the word FDA approved for a lot of our regenerative therapies. They are FDA compliant, and they are products that will be utilized in our clinic because of the things that they contain within them, the growth factors, and the things that we already know our body has within it to heal itself, that usually declines with age, as well as stress. And if we want to heal as fast as possible, as quickly as possible, then we would like to be as young as possible. And how can we get as young as possible? And what are some of the different methods that are being used in regenerative medicine worlds today, especially when it comes to orthopedic and joint conditions, pain, and people wanting to get back to function. So who do we see? What's some more information about these treatments? Understand the regenerative therapies and how your involvement as a patient can impact your outcome. So who will call us to book ultrasound diagnostic exams and then proceed with injections? Well, we see all kinds of individuals. Continue to share. Athletes, we see individuals with injuries, we see, weekend warriors, we see those, like myself, who probably may work out more than I allow myself to recover and have some soreness, unexplained, unresolved pain, those with chronic inflammation, as well as individuals wanting to, walk and run and exercise again, or bend down and wash their grandkids in the bathtub. Or we also see people looking at it from a prevention approach, prevention, longevity, the benefits of, these growth factors for somewhat turning back the clock of time, at least keep you as young as possible. And then those wanting to seek a youthful appearance, have their skin be like baby skin again. So we often use ultrasound to diagnose conditions, and that is a big, big asset and a benefit that you get with our clinic. Ultrasound diagnostic exam gives you real-time imaging. So in lifetime, the ultrasound doctor, usually we have Dr. Michael Meng in our clinic, and he will diagnose the joint tear, the ligament, the tendon, the fluid. It all probably looks like just an ocean to you on the screen, but to him, he can distinguish the tiniest nerve that's inflamed and measure it and say, well, this isn't the right size of nerve, it's too swollen, and that's the cause of your pain. Or most likely this ligament was an old injury, but your more new recent pain is probably coming from this meniscus or this fluid inflammation that's around, these discs in your back. We look at head to toe. We can look at neck, back, shoulder, elbow, hip, knee, any sort of torn muscle, pec muscle tears, Achilles tendon tears, ankles, feet, toes, arthritis, all of these things can be seen on ultrasound. A lot of people say, well, I had an x-ray and the x-ray looked fine. Well, x-ray typically looks at bones, whereas ultrasound can look at soft tissue and bones. It looks at the surface of the bones as well as the cartilage. The amount of inflammation can be measured. The actual pixel resolution of an ultrasound can oftentimes be more precise and more finely grained and granular than an MRI. Moreover, ultrasound is able to look at the anatomy in any dimension. So obviously, when you go through an MRI, you're going kind of from head to toe or from foot up, and they're looking at slices like a credit card, slices this way, and then they put them together. So it's very like linear and perpendicular. Whereas ultrasound, you can look at a nerve in an angle. You can move the probe around to position it in line with the body's anatomy in lifetime. So even if somebody has a little bit of abnormal anatomy, or they want to show the doctor, this is exactly where it hurts. That's the benefit of the ultrasound, because it can tell where the pain is actually coming from based on, the patient being involved and saying, every time I move my shoulder this way, that's when it really, really hurts. And the MRI may not see that AC joint separation if it's just having you stay still in this position for the MRI imaging, just as an example. We use ultrasound then to guide our injections, which will improve the accuracy of the procedure and the outcome of success too. If you can get the good juice in the right spot, then you're off to the races for healing. We have a lot of advanced injection options, and some of these come from our own body, and some of these options come from external sources, from labs that are FDA compliant and that are extracting placental derived tissue, stem cell growth factors, and Wharton's jelly from the inside of the umbilical cord. There's lots of different options, and we'll kind of go through them in the next few slides. We like to have patients choose the best option for them, what they're most comfortable with. We also usually give patients a hierarchy of what we've seen maybe the most efficient investment, the most likely to work in, X or Y number of months. And sometimes it's a stacking approach where you might start with one solution and then move to another solution till you get complete resolution. Because again, our problems usually don't develop overnight and then we come in the very next day to the doctor. We usually have a lot of time that we wait and we try other things. We try some therapy, we try some rest, we try to wait it out. And then we come in many months or many years later. And that, healing process will then take some time to work back the clock of time to bring back some restoration and some healing. So PRP, Regenerative is kind of maybe a fancier version of PRP. These are some treatments that are being used that use your own body's blood. The blood is taken out through a blood draw, and then it's processed in a centrifuge, and then the golden serum, like you can see in the syringe there, can be re-injected into the injury. So you can kind of imagine an Achilles tendon rupture. Some people have experienced that for themselves, and it's extremely painful, and they really can't walk on that foot. So we can look at it on the ultrasound, and a lot of times we'll see that the tendon sheath is still intact. Like a sausage, the outer casing is still there, holding the tendon kind of structure down to the bottom of the heel, but the stuffing has been torn. So we want to refill that stuffing and then stimulate the body's own healing work to go and bring the healing. So a lot of the patients will experience significant relief after one treatment for like an Achilles rupture with PRP. It's great because PRP has a higher volume and it has a lot of growth factors, especially for our younger patients, where the platelets in your blood have a certain number of growth factors when you're young and a baby, and then they decline as you get older. So PRP's effectiveness can vary based on your age, and it can be a little bit more inflammatory and a little bit more painful than some of the other more cutting edge methods for the healing and the recovery process. But it can be very effective, and it can also be a helpful volume add to some of the other ingredients. So bone marrow, in your own bone marrow and in your fat are your own body's stem cells. So these therapies that people are doing nowadays to use a sterile process to extract the stem cells outside of out from your bone marrow and then out from your fat or your adipose tissue are being used with advanced techniques. Technology has been advancing over the last 10, 20, 30 years to take these signaling, little vehicles from your body's one area and injecting them into another area in your body where you have the injury or the pain, and you want to see the body get to work on healing. So we talked about the stem cells contain the growth factors that do the healing work, and we can take a few hours in the clinic to extract those stem cells and centrifuge and process them, and then re-inject them into your body that same day. And we can do this with young people, old people, but the youth of the person will predict a higher chance of a single treatment being successful, because the stem cells' potency of growth factors declines over time. A2M is alpha 2 macroglobulin. So that's a fun word to say. It's a protein in your blood that can neutralize the destructive enzymes in the joint space. Now, many of us know about being told, oh, I have arthritis, and a lot of times A2M is helpful when considering osteoarthritis, because we already have A2M in our blood, but if we can concentrate it into a syringe, through that centrifugation and filtration process that we have in the lab, and then re-inject it to help stop the progression of the arthritic pathophysiology going on in the body, we can help to support the joint health, and patients can become more active again, even if they have arthritic joints. So we have a lot of patients coming for A2M maintenance every few years to keep their arthritis at bay and to keep it from progressing. A2M isn't very regenerative in terms of growing, stimulating the growth of cartilage again, but it will do a good job of preventing that cartilage from degrading worse. So if you have thinning cartilage on your knees, thinning cartilage in your hips, maybe some grade 1 or grade 2 arthritis in your shoulders that you've been told by your doctor, and you want to maybe do a combo method, or you want to do a procedure after surgery, A2M can be a very effective option to consider for secondary and tertiary prevention of worsening arthritis, and maybe throw in something more regenerative to actually bring back some of that cartilage growth as you get more, you get more time, do one procedure, then a couple months later, do the other procedure. So this is a lot of text. Basically, we have some other solutions that we are offering our patients here in the clinic that come from labs, like I said, FDA compliant labs that do all the testing. Basically how they work is these labs will take a placenta and umbilical cord from a tested, healthy C-section delivery, and the mother's donated the placenta, and obviously she's been tested for diseases, and all kinds of screenings have taken place to make sure it's a very healthy placenta and a healthy umbilical cord. And then stem cells are, richly in those placenta and umbilical cords, because those stem cells are signaling to the baby to grow, rapidly and beautifully in 9 months. And then those growth factors and stem cells are able to be utilized by others if they're extracted in a sterile, very safe, high-tech lab and high-tech processing facility. So we take those products from those labs and we can inject them. We can use them for IV infusion. We can use them topically for aesthetics or for wound healing, or also for intranasal approaches. So these different vials and therapies have slightly different characteristics about them. Some are a little bit more helpful for structure. Some are a little bit more helpful because their size of the molecule is very small and has the potential to get in through tiny filters in our body, like the blood-brain barrier, and people will use them for neuroregeneration goals. And also sometimes these therapies are just the most powerful because they are so young. These original stem cells from the placenta are coming from the placenta that's very young and very potent, and the growth factor concentration can be super high. So that vehicle is just jam-packed full of the most letters that your body could need to get letter and text message after text message to say, get yourself to healing work and get going on that work. Prolozone, prolotherapy is actually a procedure that's been around for a long time. Prolotherapy has been used with sugar water to inject into tendons and ligaments to stimulate a bit of an irritation and then get the body to wake up and pay attention and start going to work to heal that tendon or ligament. But if you add supercharged oxygen molecules to that specially crafted solution, with saline and sugar, water, and some B12, it's another option if someone wants to do something that can potentially require a few more treatments to complete the therapeutic result, but it's sometimes a little bit more of a first line approach before going to the big guns of the other therapies that we talked about before. So this has been really helpful as well to add in conjunction with some of the big gun growth factor regenerative injections. So you can use this therapy to help a lot augment the treatment of other conditions. A lot of times it's very effective around nerves, and it can reduce pain very quickly. When I had it done, it was a little bit of a burning sensation for the first 10-15 minutes. And then within an hour or two, the pain around my neck was gone. So I really felt like it was a great combination for me with other regenerative therapies. Hydrodissection is a really fancy word that we can claim ourselves as real specialists in here at Joy Wellness Partners because of our doctor's expertise in knowing the anatomy of the body. So he knows the nerves, where their pathways are, like telephone wires all the way from your brain down to your toes and then back up again. And a lot of times those nerves get pinched or they get compressed because of either a structural injury like a muscle tear or a muscle strain, or because of a chemical inflammation or just whole body inflammation because of illness. And sometimes it's like an autoimmune condition or rheumatoid arthritis or Lyme's disease, or even something like COVID can set off inflamed and inflammation around nerves. And then also, like we talked about the injury, like pinched nerves, a lot of times people will feel these pain conditions and they will go to massage, but we like to consider hydrodissection like an internal massage where you're taking like those jets, like on a waterbed or whatever. I'm thinking of like a jacuzzi, where you've got those like water jets and you're kind of like hoping that they'll help to relieve some of your pain from the outside. We can kind of take micro water jets and use the fluid inside the syringe to open up the space around the nerves inside your body and give that nerve space to freely move up and down, have all that tissue be released off the nerve so the nerve can then get not only restoration of blood supply back to it because it's not being pinched off and having limited supply of blood and oxygen, so it starts to be happier just in that way, but it also has like the spider webs broken off of it that are tethering the nerve down to the fascia or in between the fascia and between the muscle layers. So it can be incredibly relieving for a person just to have their their fascia in between their muscles released, and so their nerves are free again. We do hydrodissection around a lot of different nerves, but hydrodissection can be a very effective therapy for conditions like sciatica or carpal tunnel syndrome or tarsal tunnel syndrome. Even sometimes it's used for compartment syndrome to open up the space so that blood flow and lymphatic drainage can happen. There's so many different methods or effective indications for hydrodissection, and we often include it with other joint injections that we do here because there could be like an arthritic joint, but it's also chemically causing inflammation and irritation around the nerves. So then to finish the treatment, we will hydrodissect the nerves around that inflamed shoulder, for example, and provide a lot of relief. Hydrodissection around the spine is one of our specialties. A lot of spine patients will come to us because of our doctor's expertise in both being able to diagnose the spine, but also to treat the spine with effective injection therapies. So that's kind of the methods that we would like to talk about today in terms of what options are available for mostly ultrasound guided injections for pain and injury recovery. The frequently asked questions you can read them, but most patients do find that there's way more benefit than stress when it comes to the pain that they go through for the procedure. Most people are saying that, if they have a little soreness, depending on the therapy that's used, like PRP, is a little bit more sore for maybe like 48 hours inflammation, but the more fancier therapies that we get from labs may be a little bit pain relieving even in the day after the procedure. And a lot of people during the injections, they're just amazed at how quick it was till it was over with. Sometimes it's like a pain that feels good, and you know it's like the right kind of pain because they finally, for the first time, someone actually knew how to find what was going on inside your body, and they got right on target. And so I know for me, I'm like, that's such a confirmation that it hurts so bad because you got right to the spot that needed the healing relief. How we know it will work? Well, everything is never 100% guarantee when it comes to personalized medicine and when it comes to each individual patient. But we have a high chance of success in our clinic because we are so expert at the imaging that we review, whether it's your MRI combined with our ultrasound imaging. But we also discuss your medical history. We have a pre-consult phone call to determine what might be a likely chance of success for you. And of course, we try to listen as best as we can to your individual factors that might make one recommended treatment better than another for you. How do I know if I'm a candidate? Well, schedule a consultation first. If you want to do a phone call first, we're very open to that, just to discuss, am I a candidate? And then most cases, yes, you're a candidate. There's very few cases, maybe cancer would be the one where we're a little bit more leery to treat in an active cancer case. But aside from that, we go through blood work if we need to, review your medical, your current symptoms, and we'll discuss any prior treatments that you've had to determine the best approach for you in this current moment. Costs do vary based on treatment type and complexity. Our prices are typically a little bit more reasonable than some international, like say international stem cell clinics in Mexico or Colombia. Our pricing is usually under $5,000 when it comes to joint injections and spine injections. So it can vary. It can be way less than that. It can range from maybe like, $1,000 up to $4,000 kind of thing. And we often give people cherry payment plans. Insurance, as you see in number 5, doesn't traditionally cover it, but we do provide documentation if needed for HSA and FSA, and most HSA, FSA cards go through no problem here. And like I talked about, our cherry financing plan, so you can pay depending on your credit. Most patients get up to a year, 0 interest to pay off their treatment, and that's been a big help. How long do the results last? Now, this is something that, we don't claim to have an exact answer on, but most people will keep on healing and keep on healing and keep on responding to the signals that are put into their body for 6 to 12 months. They're still getting better and better and better. And then after about that 12-month period, and you can get a reevaluation and think like, oh, I'm not even thinking about my right shoulder anymore. Now my left shoulder is the one that actually hurts, and I notice that one more. So I guess my right shoulder must be doing pretty well. Or you get back to all the things that you love to do, and you just kind of forget that you even had this concern or how bad the pain really was. So kind of like patients that I've seen over the years, after the thousands that we've treated, most of them will not call us back for multiple years, 3 years, 5 years, say, if I need you, I'll call you. We've been here for 9 years, and there's patients that have not come back after their treatment. And, in some cases that may not be a good thing, but in most cases I keep up with these patients and talk to them, and they say, no, Carol, we will contact you if we need you, but we're still doing great. Thank you so much for what you did. And like we talked about, combination treatments are very effective. So after we do our regenerative injection treatments, then you can get back to physical therapy, which we have some great physical therapists that understand regenerative medicine and what is a good do and don't list for those rehab methods. And then they can help you with taping your joint. And also there's great, chiropractic collaboration that we have. So it is a team approach, and you don't just leave the clinic and go back to life as usual, because we really want you not to have that injury come again. There are definitely factors that you can take a part in. by not smoking, by working on your blood sugar control. We have experts in the clinic to help you with that in a very natural way, as well as the obesity concept. It's definitely not disqualifying you at all. The treatments will still work, but we want you to have the optimal best results possible. So working on, your weight, your blood sugar management, the toxins that you might know about or not know about, we can talk to you about them. About alcohol will decrease the growth factors in your PRP, for example, and will decrease the growth factor response in your body. So we recommend patients avoid alcohol before and after the treatment for a margin of time. Nutritional status, protein rich, vitamin rich, iron rich, B12 rich, vitamin D rich diets are very good. And hormone optimization patients will do really well with regenerative medicine therapies. Patients that are younger, again, have more optimal hormone levels. So they will do extremely well. And if you have questions about hormones, and if your hormones are maybe not optimal, that's something that we can optimize throughout the initial visit you come with us, and do your blood work and do the consultation and get you some hormone optimization options, so that during that time of 6 months to 12 months while your body's healing, you can add those extra support methods that will help to give you a higher chance of success and healing, and reduce the progression of the aging body. So we have some pre-treatment lab testing options available that we can give you if you're very interested in optimizing your treatment from the very, very get-go. These are complex list of labs, or comprehensive list of labs, that we would love to recommend to patients if they have the time to do pre-treatment lab work before the regenerative procedure, and give you the highest chance of success. So we'll talk about that in more detail. We have these different varieties of expected improvement outcomes. They can vary, but there are some faster results. The hydrodissection does provide more immediate relief than most of the other regenerative therapies. And so for those, we expect patients to be patient, because it can get a little more sore for a little bit before it gets better. And each person's healing response is very unique. So partner with us at JWP. We are a really caring team that would love to help you understand what's best for you, how to personalize the care for you, and get you back in the game, get you back to the life you love, and work with you to make it the best experience possible. So let me know if you have any questions. You guys can always email us and reach out to us. And we always have some ongoing specials and opportunities for the best, let's see here, specials for December. So for December, the special is 25% off any diagnostic, ultrasound, PRP, or growth factor regenerative therapy. So the month of December is your holiday gift to you. Please contact us for 25% off any treatment, any diagnostic exam with regenerative medicine here for relief, recovery of any pain or injuries or arthritis that you might be going through. Thank you so much for listening, and we'll talk to you soon.